Hi, my name is Martin Reyes, and I'm going to tell you about the notes I took from test taking strategies regarding circulation. The first principle that we went over is that all human cells require oxygen for life. Interruption of oxygen supply to the body's tissues will result in cellular damage and death. Decubitus ulcers are caused by a prolonged pressure in any area of the body that is oxygen impaired. Um, on the term infarct, as in cerebrovascular accident, means like for if you had a stroke or something. Um, when you're referring to the skin, you have a decubitus ulcers when there's lack of oxygen. When you're referring to the heart, you have a myocardial infarction. When you're referring to the brain, you have a cerebral vascular accident. When you're referring to the placenta, you have fetal cell damage. Another principle is that the human heart is a two-sided double pump generated by electricity. When you have decrease in the SA node, which sparks off the electrical conductivity, you have a decrease in cardiac output. When you have increased stenosed valves, meaning if you have plaque and like an artery that's closed, a valve that's closed in your heart, you have decreased cardiac output. When you have an increase in myocardial infarctions, you actually have a decrease in cardiac output. When you have a decrease in cardiac output, you have decreased oxygen to your cells, and a decrease in kidney function, and a decrease in mental status. And mental status will seem at first disoriented, then combative and restless. Then they will seem unconscious, and then they will actually have permanent brain damage. So an increase in carbon dioxide will lead to a decrease in oxygen, which will lead to a decrease of the overall function of the organs in the body. Uh, Another principle is that veins and arteries are the passageways for circulation of oxygen to the cells of the body. Adequate oxygen transport relies on integrity of the veins and the arteries. Arteries carry oxygenated blood from the heart to the body. Veins carry deoxygenated blood from the body to the heart and lungs. Heart and lungs. A decrease in vein function equals varicosities, which result from a pooling of the blood. So varicosities are basically swollen, bulging, or engorged veins with weakened walls. This actually leads to peripheral edema, extremity coolness, and aching or tenderness in that extremity, which also may lead to thrombus formation, which is very bad, which will lead to an impairment of circulation in that extremity. Plaque is an accumulated fat, cholesterol, or other elements which will lead to decreased blood flow and the increase in pressure of the artery. Plaque formation is atherosclerosis, which is a narrowing of the arterial lumen. So a narrowing of the oxygenated blood, vessel. It's actually getting smaller. So the arteries are getting smaller, more narrow. The rigidity of arterial walls is arteriosclerosis. So basically, the walls of the arteries they themselves are getting more rigid and less elastic. That is arteriosclerosis, which leads to increased arterial pressure. Both of these are degenerative changes and decrease arterial blood flow, which is basically blood flow by the arteries to your body of oxygenated blood. The other principle is delivery of oxygen to the cells is dependent upon microscopic blood cells which carry oxygen gas. The blood cells we're referring to are red blood cells and hemoglobin. They carry oxygen to cells and remove carbon dioxide from cells. The heart pumps blood. The veins and the arteries are the passageway through the different parts of the body. The blood cells carry gases through these passageways. The patient with a decreased number of blood cells, meaning hemoglobin and red blood cells, are those with significant blood loss will show these signs and symptoms, which would be impaired oxygen, pallor, dyspnea, shortness of breath, and fatigue. Others that are at risk are those with poor dietary intake of iron, hematopoietic diseases, which is blood diseases such as polycythemia vera, which is too much red blood cells, overflow of red blood cells, which I believe may lead to, I forget, I can't think of it right now, but or those with leukemia, which is the white blood cell self-attacking disease. Then a bone marrow, those with bone marrow depression secondary to cancer or chemotherapy and radiation therapy also have a decrease in oxygen because of their blood cell count. This is Martin Reyes. Hope you enjoyed this. Hope this helps you. If you have any questions, go ahead and comment this video. Like the video if it helped you at all, and listen to it a couple times because it helps. Thank you.